Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. National Bureau of Statistics releases National Longitudinal Phone Survey detailing socioeconomic impact of the pandemic in Nigeria. South Africa joins the US and EU to halt rollout of Johnson & Johnson jabs following reports of rare and serious blood clots. Caesars giving the Oxford AstraZeneca COVID vaccine amid concerns about rare cases of blood clots, the first European country to do so fully. Now, 74 new confirmed cases were recorded in Nigeria, putting total figures till date at 163,911 cases. The 74 new cases are reported from 9 states, Lagos recording the highest 30, Enugu 11, the FCT 11 as well, Akwa Ibom 8, Osun 5, Kaduna 4, Ebonyi 2, Rivers 2 and Ekiti 1. While the discharges today are 138, which include 21 community recoveries in Akwa Ibom State, a total of 154,225 cases have been discharged, and 2,061 deaths have been recorded in the 36 states and the Federal Capital Territory. The country has had a steady run of low figures in the past 1 month. Daily infections averaged over 1,000 between December 2020 and February 2021, during the peak of the pandemic. Meanwhile, Nigeria received nearly 4 million doses of the coronavirus vaccine produced by Oxford AstraZeneca through the WHO-led COVAX initiative on March the 3rd. At the beginning of March, Nigeria began its inoculation drive, and as at the last report from the National Primary Healthcare Development Agency, about 1 million people have been vaccinated. The current phase covers health workers and other frontline workers, although Nigerians from other groups are also getting vaccinated. And from the National Agency, Primary Healthcare, in charge of the vaccination rollout, Nigerians are advised to continue to wear the face mask, to practice physical distancing and sanitize their hands frequently. According to the agency, the coronavirus vaccine does not prevent infection, but prevents the progression of infection to the development of the disease. Now, over in South Africa, it says that it is voluntarily and temporarily suspending the rollout of the Johnson & Johnson COVID-19 vaccine following the announcement by the Food and Drug Administration, FDA, of the temporary suspension of its use in the United States. Yesterday, the U.S. Centers for Disease Control and Prevention, as well as the Food and Drug Administration, recommended that the country halt the use of the Johnson & Johnson single-dose COVID-19 vaccine after 6 reported cases where patients developed rare and severe blood clots. South Africa has already administered the same vaccine to nearly 300,000 healthcare workers under the Sisonke trials, and more doses are en route for use in the mass vaccination drive.
As advised by the U.S. Food and Drug Administration, South Africa's Health Department held consultations with the researchers leading the Sisonke trials, the Ministerial Advisory Committee, as well as the South African Medical Research Council, and this is the outcome.
Based on their advice, we have determined to voluntarily suspend our rollout until the causal relationship between the development of clots and the Johnson & Johnson vaccine is sufficiently interrogated. SAPRA will collate information from Johnson & Johnson, the FDA and other regulatory bodies to make a thorough assessment of the situation and advise us as a regulatory body that has exercised its authoritative powers on the approval of the vaccine in their own right.
Nearly 300,000 health workers have been inoculated with the Johnson & Johnson vaccine in South Africa under the Sisonke protocol without recorded major adverse effects. The health minister was asked if this suspension was not a knee-jerk reaction given the low risk-benefit ratio of the vaccine, even in the U.S. scenario where only 6 people out of 6.8 million exhibited blood clotting.
We think that it's a precautionary halting, so it's not like we're closing down on the Johnson & Johnson. As soon as the information is made available, we're quite certain that we should be able to move on.
The minister hopes that phase 2 of the vaccine rollout plan in the country, expected to begin mid-next month, will not be veered way off course with this development, especially as the country has secured 10 million additional doses of the Pfizer vaccine, bringing the total to 30 million. The Medical Research Council is also studying relevant data on the Johnson & Johnson vaccine to see if the process could resume as soon as next week. Also, as people are expected to register en masse next month, a risk awareness consent element will be added to the online registration platform. From Johannesburg, South Africa, Betty Dibia, Channels Television News.
In the meantime, some residents seem confused as to why South Africa is suspending its use of the Johnson & Johnson jab. For someone like Johan van Rensburg, a local resident in Johannesburg, he says Health Minister should have given reasons for the stoppage.
He's left us all wondering. He could have furnished us with some reasons and told us why, given us some scientific research behind his decision. So until now, all of us are left wondering.
I don't think it's a good idea because we need it. We need to be vaccinated so we can survive.
Well, I think it's a little bit premature given the fact that we have had no local reports in terms of the blood clot. But however, you can understand the minister's decision given the fact that FDA is one of the leading in terms of the health organization in the world, and you know what happens in the US tends to influence what happens in the rest of the world.
It's a good thing, I'll say, because it can save lives.
Well, staying with the suspension of the vaccine made by Johnson & Johnson, Dr. Mercy Dionwe is an internal medicine hospitalist, Texas Hospital in the U.S. She joins us for more on the situation. Thank you for joining us on the program.
Well, thank you for having me. Happy to be here.
Okay. So the U.S. first, they started with pausing the rollout of Johnson & Johnson following those reports of blood clots. What's been the reaction in the United States since then?
Well, the reaction has not been a good one. There is already an increased vaccine hesitancy, meaning there is a high rate of people who don't want to take the vaccine due to concerns. So this new report has just increased more people to kind of be on defense of receiving the vaccines.
So as a health worker, does this affect the government's vaccination plans of 3 million a day?
I don't think so. What the White House has said is that this does not delay their vaccination goals because they have enough Pfizer and Moderna in storage for them to be able to administer the vaccinations to the Americans. So yes, no, it does not affect it. But it is a little bit of a bump on the road that hopefully we can overcome once likely they are able to resume it.
What as well does this remind you of? Also, you know, a similar thing that occurred with the AstraZeneca vaccine. I mean, for this one now, we understand that all 6 cases were among women between the ages of 18 and 48, and the symptoms occurred 6 to 13 days after vaccination. Quite a lot of similarities, yes?
Yes, it is. And it's because they're the same type of vaccine. You're dealing with adenovirus vector vaccines. And we are seeing that in these type of vaccines that there is an increased chance of blood clots. Now, the mechanism of why they're having these blood clots is not known for now. There are some speculations, but we have to make sure we recall or remember what the overall picture is. Like here in the US, like you said, there are 6 cases, but there's been about 7 million vaccines that have been administered so far. So if you look at it and you calculate it from a ratio standpoint, that is literally 1 out of 1 million people who have gotten this reaction. So it's very rare. But out of the abundance of caution, the FDA and the CDC have said, let's hold off for a while we can look more into these cases and then maybe devise guidelines and make sure that the healthcare workers are aware of this rare adverse effect to the vaccine.
So looking at the overall picture coming from the US, the cases being recorded, what would you say is the age group sustaining the resurgence of the pandemic in the United States?
Well, that's a wonderful question. So as a healthcare worker that treats COVID patients in the hospital, what I've noticed is now we're seeing a surge of people in their 30s till up to 50s. And it makes a lot of sense because the vaccine, when they first started rolling them out to the Americans, the first group were the older population, so the 70s and older. And so I do recall prior to vaccinations, you would see a lot of 70s, 80s, even 90-year-olds coming in and being hospitalized in the hospital. But now that they've gotten their vaccinations, or a majority of them have gotten their vaccinations, those that are coming in are the ones that haven't yet gotten their vaccination. So we're seeing not as many as far as number of people in these age groups, which is the 30s to the 50s, getting their vaccination. And hence, they're the ones that have caused the upsurge in states just like Michigan that we're seeing.
So finally, just before we let you go, we understand that in the EU, Denmark has ceased giving the Oxford AstraZeneca vaccine totally. So no one there will be getting it. Do you think that's a wise decision?
Can you say that one more time? I'm sorry. It came out.
So the question I asked was that Denmark has fully said it won't be rolling out the Oxford AstraZeneca vaccine totally. So no one there will be getting the AZ vaccine. Do you think that that's a wise decision, given the breakdown you've given about more of the benefits of the vaccine so far to fighting the pandemic?
Yeah. I mean, I understand that they want to be cautious in regards to vaccinations and the adverse effects of them. But just as I said earlier, as you pointed out, we do have to really realize what is the benefits of the vaccinations and what versus what is a risk. And as we're understanding, yes, although there is a risk of blood clots, particularly in the younger population, this risk is very minimal compared to the number of people who get it. So you're seeing, in some cases, they're seeing 1 out of 100,000. I believe Germany reported that. But here in the US, so far, it's been 1 out of 1 million. But you have to now understand what is the benefits. And the benefits, as you had pointed out, is to reduce your incidence of having a very severe form of COVID-19. And part of that severe form of COVID-19 is you do develop blood clots. So I would, for countries like that who have totally dismissed getting the AstraZeneca, perhaps they have additional data that I'm not aware of, but I would highly, probably recommend just to kind of weigh in the benefits and risks. And so far, what we're saying as healthcare professionals is there's a lot more benefits to receiving the vaccination than there are risks.
All right, we'd like to appreciate your time. Thank you so much, Dr. Mercier Dionway, internal medicine hospitalist, Texas Hospital in the U.S. Thank you for joining us on the program.
Thank you.
We have more on the COVID-19 update. We take a look at the socioeconomic impact of the pandemic in Nigeria. Stay with us. The 10th round of the Nigeria COVID-19 National Longitudinal Phone Survey, COVID-19 NPLS 2020, has been implemented by the National Bureau of Statistics in February 2021. These surveys are part of a World Bank global effort to support countries in their data collection efforts to monitor the impacts of COVID-19. The survey conducted is the 10th of a planned 12 rounds of the COVID NLPS of households in Nigeria, where over 1,000 households from the baseline were contacted. The data is set to be representative at the national level, and survey weights were calculated to adjust for non-response and under-coverage.
The coronavirus global pandemic has impacted many sectors in Nigeria, including the economy, which has resulted in income losses, job losses, health concerns, amongst others. The COVID-19 National Longitudinal Phone Survey, COVID-19 NLPS, is a part of the World Bank's efforts to monitor the evolving nature of the pandemic and measure its impact globally. In the 10th of a planned 12 rounds of the COVID-19 NLPS of households in the country conducted February 6th to the 22nd, 2021, the impact of the pandemic on employment and livelihood, share of Nigerians deploying safe practices to prevent the spread of the disease, and vaccination concerns are the focus. According to findings on employment information from working age individuals between 15 to 64 years, data shows that the share of Nigerians who were working in February 2021 was only slightly lower than the share working in September 2020 and higher than the share working in January-February 2019. But the working situations have been most volatile for individuals living in poorer households. Regarding people's concerns about the COVID-19 crisis and their attitudes towards vaccination, the vast majority of respondents had agreed to be vaccinated, while 65% of respondents reported that they were very worried about themselves or someone in their immediate family becoming seriously ill from the disease. The share of Nigerians deploying safe practices to prevent the spread of the virus, including hand washing and mask wearing, includes about 76%, who reported wearing a mask when in public in February 2021, compared to 60% in November 2020 and 72% in August 2020.
Professor Titolola Obilade, Associate Professor of Public Health, Nile University Abuja, joins us from Abuja studios. Thank you for joining us on the program. I want to start with the survey's report on vaccinations, which shows that majority of respondents would agree to be vaccinated, with people in rural areas showing willingness to receive a jab, unlike respondents in urban areas. I mean, one would think that it would be the other way around.
There are many ways we can look at this. You remember the study was conducted in February, and during those months, from January to February, we had increasing cases of the COVID. And so there was a fear factor there, and so people were ready to do anything. That's one. So it could be that the people that responded were like out of fear because they can see the cases rise and they'll do anything. And prior to that, the vaccines hadn't reached here. They had not had cases of blood clots. There was no fear factor there. That's a different type of fear factor. So the fact that they saw cases rising after an initial dip some months before that time will put them to say, oh, they want to get vaccinated. Another thing you can look at is that during the correspondence from the phone conversations between those who were interviewing them and those responding, as it is with things with government, they might feel, oh, maybe if I say I want to get vaccinated, maybe they'll give me something, a token something. So that effect is still there. You know, they could say, well, you know, let me just say I want to get vaccinated, you know, so I can get something out of it. Who knows? And so that factor, we do not know how much of that factor that played there. But definitely, everyone that was able to respond will have noticed that there were increasing numbers of COVID-19 cases, not just in Nigeria, but all over the world. So at that time, and we didn't have any vaccine at the time, so they will definitely say they want to get vaccinated.
Unemployment, we had more women working higher than previous, and more in commerce industry, looking at the breakdown with the NBS. Would you say the pandemic impacted women more than men in more ways than one?
Right. Yes, the pandemic definitely affected women much more than the men. When we have two working breadwinners in the household, okay, even if you have in academics, you realize that the burden of children, taking care of the children, it falls on the woman. And in the case of maybe in the respondents of what we have seen from this survey, the women are more able to get simpler jobs. When I say simpler jobs, if you can cook, you have a pot at home, you have a cooking spoon, it doesn't take that much to be able to get some food together and say you are selling, because food will always sell. And then we also have women that are able to go into childcare, because for those who are able to work and maybe their schools had not yet resumed for the children, then more women are able to say, oh, well, you're not doing anything. Let's start doing some childcare. And so they find out that they can have the informal sector, which has expanded for them. So this type of thing, selling of foods, taking care of children, including their own children, it gives an extra income. And then at the month that the survey was done, the economy was down. I mean, we're still trying to expand on our economy. But the time the economy was down, a lot of Nigerian households were trying to get more money in. And so, like the saying goes, it's just not one road that leads to the market. So every available means, and then the kind of jobs that women will do is more malleable. than what the men will have to do. They might have to go to the service providers to be able to get their own jobs done. But the woman, just the woman alone, she can do the home care. And then some can also become caregivers on one-on-one. You know, so they're able to do those type of things. They can become cooks, and so there's a variety of jobs that more women are able to do. And the women in the home, they have this this thing that, oh, they can't just wait and starve. You know, they've got to find a means of getting things done. So you find out that they're able to, like, something must be done. And so that's why you can have more women going into the labor industry.
Finally, Professor Obilade, further surveys are expected to be conducted. Do you see this assisting policy decisions, healthcare transformation, you know, as we exit the pandemic?
Well, yeah, actually, you know, this survey was done in February. That's almost 2 months away. This is now April. So the time the survey was done, it should have been excellent. I mean, if the result came out within a week of after completing the results, you know, completed survey, because what the things that were in effect then, if we look at it now, it's kind of past the event, because then we're having some lockdown, the vaccines had not yet gotten to Nigeria, some level 12 workers were still staying at home. So a lot of things were there. There was a lot of fear. And then for when the vaccines came, because like in the now, when the vaccines had come, there's still the hesitancy there, there's still the reluctance there, you know, there's still the conspiracy theory there. So when people are even getting the vaccines, they're like, oh, why are we getting this particular one and not that other one? And so the fear that is here now in the month of April is different from the fear that they had in February. But as to your question, that does it actually play a part? Yes, it does, because we can always extrapolate and like, well, if this happened 2 months ago, okay, let's see how things will change in the next survey. And so we can do some balancing act and say, okay, how do we go about it? Which is where we'll talk about the primary healthcare centers. You know, like I was saying, I write it in one of the national newspapers, and primary healthcare is one of the reasons, you know, that we can key into to get people to reduce their fear factor when they have somebody from within their community talking to them, like a village health worker, a volunteer health worker talking to them. They see them in the community and they're like, these are the fears I have, which is different from having a stranger, a foreigner, someone that is not in their community, coming to tell them that, go take the vaccines. They need, so you see, if you can handle the fear, then we're able to progress further in getting people to get vaccinated. We're able to progress further in getting people to comply with the COVID-19 protocols. And that person comes in from within the community.
Thank you so much. We appreciate your time and your insights into the issue. Professor Titilayo Obilade, Associate Professor, Public Health, now University of Abuja. Thank you for your time.
Thank you so much for having me.
Don't forget to protect yourself. Continue to take responsibility. Visit our website. It's channelstv.com for more updates, a better understanding of the pandemic. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay safe.